This is Dr.DavidJayne, and I'm being more and more asked questions by patients about the GLP-1 medications. They are peptides, and they're produced by pharmaceutical companies, and they work by taking away your appetite. And this occurs because they give you the sensation of being full, but they do that by actually partially paralyzing your stomach. And when that happens, people eat less because they have the feeling of being full, and they do lose weight. But they usually lose a disproportionate amount of muscle mass as well as fat. And the problem is, once they stop the medication, if they fully recover from using it, which in some people they're having now some issues that are longer lasting, when they recover, the appetite comes back and they go back to eating the way they had before, and they gain all the weight back. I started my practice around the time that there was a hugely popular diet trend called fen-phen. It's fenfluramine and phentermine. And between the two of those drugs, people weren't hungry and they lost an enormous amount of weight. And they did it usually in a fairly short period of time, which is what the GLP-1s are reminding me of, is the fen-phen. And the problem is with fen-phen, in my 30-something years of practice now since then, I haven't seen anyone, not one person, who kept the weight off from taking fen-phen. So my theory is, when you take away someone's appetite and then all of a sudden you stop taking the medication, because at some point you're going to stop taking it unless you're going to take it the rest of your life, which I don't recommend, you're going to gain the weight back. So the key to solving a weight problem, and in turn solving your visceral fat problem and other things, is to change the way you eat and gradually modify what you eat. And it can be done, but it takes time. It's not rapid, and it requires you to actually change your lifestyle. I don't know that there is a shortcut that you can do other than potentially having some of the gastric surgeries for obesity, where they actually force you to change the way you eat because of the surgery. But those have fallen out of favor since everybody wants to use, at this moment in time, GLP-1s. So I don't believe that there's enough long-term data saying that they're safe. And if it's not proven to be safe, it's really hard for me to get on board and say that they're a really good thing. And we're seeing more and more complications, seems like, by the day. So I'm not a big proponent of the GLP-1 medications, and they're now saying every day, oh, it's good for use in addictions, it's good for use in Parkinson's, in ADHD, and obese children. There aren't long-term studies saying, A, number one, it's safe in all those people, but B, that it's actually going to do what they say. So I'm leery. And if you'd like to talk more about any of the peptides, feel free to make an appointment. Give us a call, 405-348-8850. And I'm happy to discuss it with you. If I don't write a prescription for medication or order lab work, I don't charge you, and that's a $200 value. I look forward to meeting you and discussing it. If I can help you, let me know. Thanks.